Medicare can be one of the biggest surprises in retirement, both in cost and complexity. Get it wrong, and you could be faced with penalties, unexpected medical bills, or gaps in coverage when you need it the most. Get it right, and you'll sleep better at night knowing that your healthcare is covered. Make sure to stick around to the end of the episode because I'll be sharing the biggest mistake people make with Medicare and how you can avoid it. It's not what you think. And spoiler alert, this could save you a ton of money and headache. Today I'm breaking down everything you need to know about Medicare, how it fits into your retirement plan, and what to do if you plan to keep working past 65 years old. Welcome to the Summit Wealth Strategies podcast. I'm Keith Fedor, your retirement specialist. I help people like you transition from saving well to truly living retirement well. Today we're tackling arguably one of the most confusing parts of retirement planning, Medicare. And in case you didn't know, Medicare isn't free. And it's not as simple as just signing up at 65 years old. There's different parts. There's A, B, C, and D, plus supplemental plans and important deadlines that could cost you if you miss them. Many retirees assume Medicare will cover everything, but that's actually not the case. Consider this. The average 65-year-old couple will spend over $300,000 on healthcare in retirement. Medicare does not cover long-term care, dental, vision, or hearing. And if you don't plan properly, Medicare penalties can last a lifetime, literally, the rest of your life. So, since healthcare is going to be one of the biggest risks to your retirement, a well-thought-out Medicare strategy is important to protect you while minimizing out-of-pocket expenses. Now let's break down the basics. Medicare Part A, B, C, and D. Medicare is split into different parts, and each covers different healthcare needs. Let's break it down. Part A. This is your hospital insurance. It's mostly free and covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. It's free for you or your spouse if you've worked at least 10 years and paid into Medicare, the Medicare taxes. If not, you'll pay up to $506 per month, which is the 2024 rates. And advisor tip, even if you're still working at 65, you should still enroll in Part A since it's free for most people. Medicare Part B is the medical insurance. This is not free. Medicare Part B covers doctor visits, outpatient services, preventative care, medical equipment, and the cost starts at $174.70 per month in 2024, and rates increase from there for those with incomes over $103,000 for a single person and $206,000 for married couples. Your deductible is $240 per year. Then Medicare covers 80% of approved services, and you pay the rest. So you can see that with Medicare Part B, after the deductible, you're still on the hook for 20%, and it doesn't cover every medical expense. Advisor tip: if you don't sign up for Part B when you're first eligible, you'll face 10% penalties every year you delay forever. Part C is Medicare's Advantage plans. This is optional and an alternative to the original Medicare. So what is it? It's essentially private insurance that combines Part A, B, and often D into one package. Many have low or even zero premiums, but higher out-of-pocket costs when you need care. Often includes dental, vision, and hearing, things that original Medicare does not cover. The downside is there can be limited provider networks, like an HMO or PPO. It may require pre-approvals and referrals. This is best for retirees who prefer the lower monthly cost, but are comfortable with provider restrictions. Advisor tip: find a local Medicare insurance agent to learn more about what would work best in your local area and based on your needs. Part D is the prescription drug coverage. It covers prescription drugs, which vary by plan, And the costs vary by plan and location. Higher income retirees pay an extra surcharge, and similar to Part B, there's a late enrollment penalty. If you don't sign up when you're first eligible and you don't have credible drug coverage, you'll pay 1% penalty every month you delay for life. Advisor tip: even if you don't take prescriptions now, it's wise to enroll to avoid the penalties later. Now that we've covered Medicare A, B, C, and D, it's important you understand something called Medigap, or Medicare Supplement. If you choose Original Medicare, which is Parts A and B, you'll need to decide whether to buy a Medigap plan to cover your gaps in coverage or enroll in Medicare Advantage, which is the Part C plan instead. Medigap is the Medicare Supplement plan, and this pays for deductibles, co-pays, and co-insurance that Medicare doesn't cover. And there's no provider restrictions, so you can go to any doctor who accepts Medicare. Premiums range from $100 to $300 a month, depending on the plan. And this is best for those who want predictable costs and nationwide coverage. If you go with Medicare Advantage, which is that Part C plan, instead of the Medigap, you'll have lower monthly costs, but more out-of-pocket expenses when you need care. And don't forget, you must use in-network doctors in many cases. What if you're still working at 65 years old? If you have employer coverage, here's what to do. Scenario 1 is if your employer has 20 or more employees, you can delay in enrolling Part B Medicare without penalty. Keep your employer's insurance as primary coverage and simply enroll in Part A of Medicare since it's free. Advisor tip: when you do retire, sign up for Part B within 8 months to avoid penalties. Here's scenario 2. Your employer has less than 20 employees. In this case, Medicare becomes your primary insurance at 65 years old. You must enroll in Part A and B, or you'll have gaps in coverage. Advisor tip: check with HR to confirm if your employer plan is credible coverage before delaying Medicare. Before we wrap up today, I want to leave you with one of the biggest and most costly Medicare mistakes I see all too often. It's delaying enrollment in Medicare Part B or Part D without having credible coverage in place. A lot of folks think they can just wait, but if you don't have qualified employer coverage, that delay can trigger lifetime penalties. We're talking 10% per year on Part B and 1% per month on Part D. Not only that, but you could end up without insurance when you need it the most. So here's the bottom line. Don't miss your initial enrollment period. And if you're still working, make sure your coverage qualifies as credible. That simple move can save you thousands of dollars and a whole lot of stress down the road. If you think about it, Medicare isn't just a healthcare decision, it's a financial decision that impacts your long-term retirement security. So plan for Medicare costs because it's not free. Don't neglect to enroll on time to avoid lifetime penalties. Decide between Medigap versus Medicare Advantage based on your healthcare needs. And if you work past 65, confirm whether you should delay Medicare Part B. Medicare and retirement planning, for that matter, can be confusing, but you don't have to navigate it alone. I encourage you to speak with a retirement specialist who can help you put all the pieces together to help make sure you're making the best choices for your retirement. Feel free to visit our website at summitwealthstrategies.com. You can find the link in the description below and request to have a complimentary consultation with one of our retirement specialists today. That wraps up our episode. If you found this helpful, please share it with a friend who's approaching Medicare age. And don't forget to like and subscribe for more tips on making the most of your retirement. Until next time, take care and plan smart.